Move more together for you, your team, and a good cause. Join the Movivo Move Days, the ultimate health challenge during Lent, and win exclusive prizes. Collect points for 45 days in the Movivo app, together with your colleagues or in your own personal way. Whether it's through your favorite sports, breathing exercises, giving up sugar, or ice bathing, every point counts. Are you ready?
A very warm welcome to the Wonder Pill Movement, the podcast specifically designed for all those who wish to take their health into their own hands. Today, we're featuring another special episode as part of the Move Days, the health challenge designed for companies and a good cause. And once again, we have an episode with a very special guest. Joining me today is Dr. Andrea Dorighi, an expert in gender medicine. This already raises many questions. The term gender is, of course, quite controversially discussed in the media. So, Andrea, to start us off, what is gender medicine in a single sentence, and how did you come to be involved?
All right, then first let's turn our attention to gender medicine. Gender medicine aims to incorporate all the factors that exist, specifically biological factors, social factors, and cultural factors, into the broader field of healthcare, and then from these draw its conclusions. Consequently, gender medicine simply aims to ensure that all individuals, regardless of their gender, whether they are young or old, or originating from countries like Austria, Asia, or Africa, receive equally good treatment. This does not imply that they will all receive the exact same treatment, but rather that the quality of care provided will be equally high for everyone. That would perhaps briefly be gender medicine. And the second question, how did I get into this? In the year 2021, so still in the middle of the pandemic, I received the assignment from our state councillor, Dr. I was commissioned by Beate Prettner to establish gender medicine. At that time, I was working together with a colleague from the Carinthia Health Fund who came from the economic sector, Paula Dostal. And we thought about how we could structure this. We created 3 pillars and simply got started. One pillar was the initial training programs for all healthcare professionals, and the second was the continuing education for these same healthcare professionals. This was intended for everyone within the sector, specifically including nurses, therapists, and also physicians. And the third pillar was the creation of awareness among the general population as well, so that the public would also understand that gender medicine per se doesn't really have anything to do with whether someone is gendered language, whether it's applied, whether you like it or not, but that it's about the best possible medical care one can receive.
Our lecture title, of course, is Health Has a Gender. So that means, or it already implies, that men and women are not the same.
Exactly.
And you also told me in our preliminary discussion that this is a truly unique institution across all of Austria. That means you also train doctors and staff from other federal states, don't you? Is that still the case? Is it considered a special institution in Carinthia?
Exactly. We have really brought a diploma training program from the Austrian Medical Association to Carinthia. We have in a first round trained 15 Carinthians, both men and women, who are active here in Carinthia. And we are starting with the second diploma course again. However, this time not with 15, but probably with almost 20 physicians from Carinthia. And we naturally also have additionally from the other federal states, now still some additional female and male doctors who will undertake this training.
What exactly does a doctor or any other medical professional learn in gender medicine? What can our listeners, our audience, expect from the next half hour? What will they take home with them?
Yes, let's just try to really start with the basics. Many simply can't make sense of the term gender medicine or what it means within that field. Some speculate, well, that it's a bit like women's medicine or something of that sort. Some others even think it has nothing at all to do with medicine, but truly only with language. No, it's really about finding the best medical care regardless of gender, women, men, or diverse. The gender gap, which is also known a disparity. We have a truly enormous knowledge gap, one that we've built up over decades in the medical field, and we must also bridge this gap. It began in scientific studies, in the field of diagnostics, in therapeutic interventions, in preventative measures, and in rehabilitation programs. Perhaps just a brief overview of the emergence of gender medicine.
Yes, let's really delve into the specifics of that. I'd be happy to.
In the US, in the early 1990s, cardiology was undergoing significant development. And there was a very, very observant cardiologist who simply realized, that she was prescribing medications primarily for cardiovascular diseases, specifically heart conditions. With men, you'll find there's an effect, but with women, strangely enough, there's either no effect at all, or very little, or perhaps only side effects. And she then, practically speaking, brought gender medicine into existence. And she said, okay, we really need to investigate why this is the case. And that why actually has quite a long history. Yes, in the 1960s, there was the thalidomide scandal. That was a new sleeping pill at the time. This came onto to the market and was then also administered to women. Specifically women who were pregnant to combat sleep disturbances and nausea. The tragic outcome was that we had thousands of newborn children who were born with missing limbs. For the protection of unborn life and for the protection of women, it was then decided, all right, we'll simply remove women from all studies. What wasn't considered then? Yes, one can now, of course, test the effects and side effects of medications in studies for men.
Oh, I see.
But only for men. What this means is that this medication is being released to the market and it has not been tested on women. This means that for decades now, we have been prescribed medications which were actually only tested on men, specifically on the model man, the standard male human being who is 80 kilograms, white, and 40 years of age. It was tested, but not on all other individuals, neither on women nor on other ethnic populations, for example. And if medications were then withdrawn from the market, there was always a good reason for it, mostly because women had shown severe side effects because we simply didn't know. We hadn't, so to speak, included them in the clinical trials beforehand.
This also means that the Contergan scandal, in essence, did not truly lead to the desired outcomes or the crucial lessons that are now being drawn from it many, many years later. The realization is that, okay, this medication should have been tested on women as well. I mean, one probably has to consider whether that's ethically justifiable at all, or when is it a test?
In contraception, it is, of course, very much possible. And it is also now the case that there are hardly any studies left where no women are included. However, what we still haven't achieved is that truly corresponding to the incidence, if now there are diseases that affect just as many men as women. Then, ideally, studies should include just as many women as men. When it comes to illnesses that predominantly affect men and fewer women, you would naturally adapt this proportion or the other way around. That's actually what one should be mindful of, and it is increasingly being considered. But we are still, I would say, on our way there, but certainly not yet at our destination.
You started earlier with that story from the field of cardiology. How did that particular story then proceed? What did the cardiologist then come to realize, and what conclusions did she ultimately draw for herself from that experience?
Yes, she had just come to the realization that the pharmaceutical drugs we had available at that time were actually only showing effects in men. In the meantime, there are now certain medications that can be effectively utilized, for example, in the treatment of heart failure, specifically for women. Interestingly, some of these even demonstrate a superior efficacy when administered to female patients, but it has genuinely taken many, many decades for us to finally arrive at this crucial stage of development. Yes. And on the other hand, there are, of course, also areas where we do have medications. One example would be osteoporosis. These are medications that were actually only tested for women. There were only studies conducted on them. However, men also have osteoporosis. So about 15 to 20% of them have osteoporosis. Firstly, people don't even think about diagnosing it. And then you find yourself in a dilemma. Okay, the medications that were tested on women are then simply not approved for men.
Yes.
So there's also the counter example, and that is, so to speak, only just now truly beginning to unfold, where we are dealing with all these problematic cases or fields. And then really look into that area and also try, of course, to find solutions, but which, again, take many, many years until studies are completed, until new medications can be found. It's obviously not something that you can just do quickly then.
Yes, that's of course, our listeners naturally want to know, okay, what questions can they ask? What conclusions can they draw from this now? Let's perhaps really dive into the practical application. Well, we've already discussed cardiovascular diseases, which are the number one cause of death in the Western world.
Yes.
And naturally, there's the heart attack as an event that occurs very frequently, but where symptoms can also be quite different between men and women. Let's delve into that specifically. What do symptoms look like in men?
What are the symptoms women experience and how?
Exactly. So a heart attack is truly the quintessential example in gender medicine. Pause. A heart attack is actually, if you were to conduct a survey on the street, is typically seen as a male illness.
Oh, I see.
Pause. It's manager's disease, or the man shoveling snow or mowing the lawn in summer. With intense physical exertion, under a lot of stress, a heart attack occurs, and it's often seen as a male problem. But that's actually not how it is. So women can also get heart attacks, and if you look at the overall cardiovascular system, it's true that just as many men as women are affected by it, and just as many men and women also die from it. And as you've already said, it's the number one cause of death for both men and women in the Western world. Yes, the man's having a heart attack, massive pain in the chest, radiating. Everyone knows what's happening. The people around are aware when you call emergency services. So it's just very...
That's what's linked to a heart attack, yes.
This is the classic heart attack, just as we learned it in university. That's quite clear to everyone, but for women, it can look entirely different. And that's the insidious part. Well, a little nausea, maybe some shortness of breath, just not feeling well.
I understand.
No one really thinks about it. And if you were to call for emergency help right now, well, you wouldn't be quickly transported to the hospital with flashing lights for that reason. And that's exactly what happens. The woman waits too long because these symptoms are simply non-specific. Perhaps also pains that rather radiate into the jaw, into the neck. That's simply something where you wouldn't immediately and absolutely think, right, that must be the heart. A racing heart, perhaps also a cold sweat. Panic attack, maybe someone else thinks of that first, so the woman waits and consequently arrives later at the hospital. Precious time is lost in the process, and that time directly determines the extent of the damage to the heart. And that damage, if you arrive just half an hour later at the hospital, is simply much more severe. That is definitely one factor. However, there are simply many other factors that play a role here. A woman, when she experiences a heart attack, is typically older because she's protected by her hormones up until menopause. That means...
Perhaps you could explain to us in more detail. Why do hormones, specifically female hormones, protect against heart attacks?
Female hormones have a protective function for our blood vessels. That means the calcifications that occur there and then lead to diseases like a heart attack. These calcifications appear later in us, and they also look somewhat different in terms of how they manifest. This means the woman doesn't realize she's getting older because she's initially protected by her hormones. Then, when she's older, she has other chronic conditions already. This means she might already have diabetes, she might also have high blood pressure, and all of these factors naturally make it even more difficult to recognize this immediately. And it's also quite common that medical personnel don't immediately consider it for a woman when she arrives at the hospital with these female symptoms, which were once referred to as atypical symptoms. And well,
how many are there who then actually present with these female symptoms?
There are certainly a great many of them. More often, the majority of individuals present with these non-typical symptoms, but both scenarios are indeed possible. However, on the other hand, there are also men who might potentially come in with these less common atypical symptoms. So there are many different factors that all play a role and interact here. Therefore, it's impossible to state with absolute precision whether it's 90% or 80%. But the majority of women with heart attacks simply don't present with female symptoms the same way as those with male symptoms, meaning like the male symptoms.
Can you give advice to a 65-year-old woman? What should she do if she's experiencing symptoms like these right now? How does one react? As you say, these are symptoms that one might have every now and then, and you might not want to overreact, perhaps.
Well, I would definitely start a little bit earlier. I would actually start precisely with menopause. There are already several important factors that need to be considered. The factors involved are, have I had any pregnancies? Have I experienced any pregnancy complications? For example, do I have conditions like endometriosis or polycystic ovaries? These are all very common conditions that typically affect women. Do I have any risk factors, such as smoking?
Mm-hmm.
Yes. Overweight. For women, it's a much more significant and intensifying risk factor than for men. That's also something important to keep in mind. Do I have a family history of conditions like high blood sugar, elevated, so diabetes, a blood sugar condition? Do I have elevated blood fat levels? At least once during your lifetime, preferably already by the age of 40, one should also get a specific value measured, specifically your lipoprotein levels, so that you can then accurately evaluate the potential risks in combination with all the other relevant factors that you might encounter, particularly as you enter the menopausal phase or once you have already passed through menopause. So these are things that you can already consider beforehand, and that you can also, well, perhaps even then quit smoking or start doing some relaxation exercises or get some more physical activity. A lot of movement helps, though again there are differences between men and women. Women might need a different kind of exercise. For them, brisk walking could already be quite effective. Men perhaps need more challenging things. They're more drawn to those. Women might not be as drawn to kickboxing or lifting weights.
The world of movement is truly vast. There's something in it for everyone.
Exactly, and everyone should really search for what truly benefits them personally. So there isn't just one single universal solution or a standard recipe, but rather something very personal where you simply feel, yes, you absolutely must incorporate certain things into your daily routine, things that genuinely do you good in that particular situation, but which also serve as a valuable form of prevention for later on.
That's very good, yes. Now you told me in a conversation, and I've actually never heard this word myself before, takotsubo. What exactly is that? You mentioned it has symptoms that are very similar to a heart attack, but please explain to us what exactly is takotsubo?
Yes, and also something very specific which primarily affects women in about 90% of cases. This is similar to a heart attack. It looks similar, and it's caused by emotional stress, by very strong emotions, which can be positive or negative. This results in a functional disorder, a constriction, then also of specific areas within the heart. The heart then also looks like a octopus fishing pod in Japan. It's called takotsubo, hence the name. But you can also call it broken heart syndrome. So it's massive emotional stress that leads to dysfunctions of the heart, which are then similar to a heart attack, usually leaving no permanent damage. However, in very rare cases, there are also fatalities.
Oh, I see.
And in some cases, a medicinal treatment is also still required. So this is something very specific that affects women.
Mm-hmm. Yes, and interesting. Pause. We've already talked about medication dosages before, and yes, these studies. That's also, I believe, a very big topic in gender medicine, that many medications are still tested on men and then are prescribed in that same dosage for everyone. No matter if the man perhaps weighs 100 kilos, is 190, or if it's a petite woman with perhaps 50 kilos.
Exactly. Actually, if you're coming from the field of pediatric medicine, we are quite accustomed when you give a child a fever-reducing or a pain-relieving medication, we always carefully look at their body weight in kilograms, and then we administer the drug. But then at some point, suddenly when they turn 18 years old, that's actually all over. But this often leads to women then simply experiencing many more side effects than men because the medications are overdosed. One of the most frequent reasons for patients to be readmitted to hospitals is often older, more delicate women who were given a brand new medication during their previous hospital stay, and the dosage they received is simply much too high for their system to handle. Many factors are smaller, more delicate. Simply kidney blood flow is different, hormones are different, enzymatically there's a different situation. For instance, the gastrointestinal transit time is also quite different. It actually takes a longer amount of time for women. This implies that any medications, once they are ingested, will remain for a longer period within the stomach and then also within the intestines. This means that a larger dose can also be absorbed. Pause. If it's a fat-associated medication, pause, it will then accumulate in the fatty tissue. Pause, and subsequently be released again over a more extended period of time. That is to say, it accumulates in the body, but this leads to overdoses, which we don't find in a man who has double or triple the weight. Instead, it's typical for an older woman, perhaps with already impaired kidney function, and who might also simply have other issues, has different underlying conditions than a medieval person. A 50-year-old man carrying double his normal weight, who eats a lot, who can still move well, who drinks a lot more. These are situations, that we actually see daily in hospitals. And maybe you'd like to give a very specific example.
Absolutely, with pleasure.
Well, yes, we are actually back to discussing the sleeping medication Zolpidem. And Zolpidem, it's a type of sleeping pill that was first introduced back in the 1990s. It very quickly became one of the most widely prescribed medications around. What was then observed in the early 2000s, again in the United States, and quite surprisingly not within the medical field, but rather in the domain of law enforcement, there was an increased number of accidents involving women during the morning hours who had taken 10 milligrams of zolpidem the night before.
So a standard dose, once again, the same for all men as it is for women.
A great many accidents would have to happen for one to even be able to draw that conclusion from it.
Exactly, yes. From this situation, it was then said, okay, a mandate to medicine, please look into this. What's going on? The result was, okay, in the USA, there is now a blue package, 10 milligrams for men, and a pink package, 5 milligrams for women. In Europe, this has not yet been achieved. The tablets have a score line, but they are relatively small. Can you imagine, for example, older women who perhaps already have problems with their joints? They have to split these tablets. What is sometimes difficult, or perhaps they've also forgotten that they should be divided and only half the dose should be taken. So we have the 10 milligram tablets. We should all, regardless of where we are, whether in private practice or in the hospital, know that the dose for women is 5 milligrams.
Of course, in recent years, a development has also occurred that people naturally do a lot of their own research, that knowledge is readily available. Yes, that patients naturally also do their homework before seeing a doctor. That wasn't really common practice 2 or 3 decades ago. So, what would you advise a woman, or really any person who now says, okay, I know I'm petite and I have this or that specific illness? How do you approach your doctor? What kind of questions can you ask, or what questions should you be asking?
The questions would be, is this dose truly the right one for me? Or even if I already have symptoms, it's often the case that with a new medication, the person then, after days or even after weeks have gone by, you still have that persistent feeling that, okay, something just isn't quite right. I simply can't seem to get myself going. I feel quite dizzy. The risk of falling is also one of those things, as one of the side effects that can arise from certain medications and from overdoses. How is my kidney function? Many people don't know that either. One must acknowledge, of course, that it is quite normal for kidney function to become somewhat restricted as one gets older. However, the more delicate or frail I am, the more I should naturally keep this in mind and perhaps inquire about it during my next visit to my family doctor. Is everything really okay with all the medications? Is it possible for me to reduce the dosage? Yes, that would definitely be a viable option. Or some pharmacists are naturally already quite involved with this. You can certainly ask them as well. But the first point of contact is, of course, the prescribing doctor. Whereas, yes, in some areas there are already quite good studies available, but in other areas that is not yet the case. Well, anyway, if you're experiencing symptoms that are quite strong and they just don't seem to go away, whether they're related to your heart or if there are other physical manifestations, it's really important to simply say, yes, this is serious. I absolutely need to get this checked out. I would like to receive an answer to that as well. And with that, of course, go to the doctor with a clear directive and perhaps demand that a bit more assertively. So it's certainly also a matter of interaction. Whether it's a female patient, a female doctor, or a male patient, and also how one expresses themselves. If you only very vaguely say, well, I'm somehow not feeling well, then naturally the other person or the people you're talking to will find it very difficult.
Yes, so if I'm understanding this correctly, then it's really important that the patient themselves perceives, feels and introspects how they're doing and then puts that into a clear formulation. Then of course the doctor or physician will have a much easier time. And yes, it's perfectly fine to critically question things and not just accept everything as it is.
Indeed.
If you notice that something isn't quite right. So I believe that's a message we can certainly convey to our listeners.
Exactly. Yes. So really make sure to express yourself, to state things concretely, and to really pay attention to how that develops. And especially when new situations arise, when new medications are being taken, then you must really pay very special attention to that.
We'll gladly take that on board. We've already talked a lot about the heart, including the specifics, that female hormones are protective to a certain degree, and that there's certainly great protection until menopause. What values should women then really be keeping in mind? What exactly should they be dealing with and considering if they want to properly position themselves for effective prevention?
Now, yes, we've already touched upon this a little bit earlier, haven't we? So truly, in terms of prevention, even before menopause, it's crucial to simply pay close attention to what exactly does my blood pressure look like and what about my blood fat levels? What are my blood sugar levels like? What about what's my family medical history? So, for example, do my parents, my siblings, do they have any illnesses or conditions that would then point towards cardiovascular diseases? And if you have that, if you have a high risk or indeed these specific factors like smoking and being overweight, then you should certainly take action. The sooner you become active, the sooner you really start with prevention, the sooner you get involved with move days.
Prevention.
You'll naturally keep progressing even after the move days are finished, because that's what it's truly about, a continuous a continuous form of preventive care.
A healthy lifestyle made simple and easy, one that eventually becomes a normal part of your life. Making healthy decisions then perhaps becomes completely natural. That's exactly how it should be. But this also applies to men, doesn't it?
Exactly. This applies to both men and women. Women might even have a bit of an advantage when it comes to sports. That's something I could also tell you about. Sure. This is a topic that frequently appears in the media. So we, as the female sex, don't necessarily need to engage in quite as much physical activity to achieve the same preventive health benefits as men do. So, roughly a third. So these 150 minutes of moderate exercise per week are enough for a woman. That's really great. A man has to invest almost twice as much.
Double the amount.
And women can also invest twice as much.
The effect is not really over. There's still something afterwards.
The effect naturally increases. So there's already much more potential within prevention, and that's primarily exercise, but also nutrition and mental health. So that really includes everyone, regardless of whether they are men or women. But as I said, when it comes to sports, we might need to do a little less. We can perhaps then a bit, still cuddle up in front of the warm fire or do something else. Read a book.
Yes, that's exactly what I mean. For the soul. But for many, this is also a sport, and it's also food for the soul, depending on how you approach and perceive the topic. But you've now also brought up the topic of mental health again. That's also a topic that's, growing very strongly across all social strata and age groups, and of course among men too. For men, however, it's often also, a taboo subject. And you told me that there are certain peculiarities regarding mental health and depression as well.
That's right. Now, if we consider the topic of depression, it's quite clear that the diagnosis of depression is actually given to women 2 to 3 times more frequently than men. And that's exactly how it is. When you look at how many medications are being prescribed, women are then prescribed 2 to 3 times as many medications for, that is, antidepressants, specifically for depression. If we look at the suicide statistics, however, and we look at them worldwide, it's a very similar situation everywhere. But then men are 2, 3, or even 4 times more frequently affected by suicides.
Okay. And when we're talking about suicide, the single most significant risk factor, without any doubt, is clinical depression.
This suggests a very strong possibility that male depression often goes unrecognized, and perhaps it's similar to the heart attack example I mentioned earlier. We have typical symptoms and we have female-specific symptoms. With depression, we then have what are considered the typical symptoms for women. But then we do have symptoms that are quite characteristic for men. And these don't manifest in the same way as they do in women, where they are completely listless, where they are deeply depressed, where they simply can't get out of bed anymore. For men, it might then look something like this: work addiction, other addictions, alcohol, aggressiveness, high-risk sporting activities. This is what a male depression might look like or can look like, but no one considers that it's depression. And if it's not even considered, if the diagnosis isn't properly established and no suitable medication is prescribed, well, then that could indeed be one of the major underlying causes why the suicide rate among men is 3 to 4 times higher than it is for women.
There were still many hypothetical conditions involved. So that means there's still a lot of research needed as well. Did I get that right?
Yes, there's a need for research, or rather just that it really is...
That in our society, it also becomes clear, and that it also becomes clear when a man is at the doctor's, that perhaps one could also inquire about such factors, which then simply present themselves differently than they do in a woman.
And that is certainly still not being done sufficiently.
Yes, that I believe is the most important message from this particular session today. That truly, yes, health is inherently as individual as it can possibly be. While it might not always be feasible to address every single individual case, we should definitely examine the differences between genders, between ethnicities, and between age groups. All of this constitutes gender medicine, if I may summarize it correctly. But what we can also take away from this is certainly the topic of heart health. Yes, these are typical symptoms, the female symptoms of a heart attack, so that we truly raise awareness that it doesn't always have to be chest pain and radiating pain on the left side, or specifically into the left side. And I believe, thirdly, very crucially, this issue of medication dosages, where simply a lot has already been das Beinweg ist sehr sinnvoll ist, that initial steps are taken and that there are truly different dosages available. And where you yourself if you notice it's not right for you. Are also allowed to be critical. And should also ask this question, when you are with your treating doctor. Dear Andrea, as we conclude, what final message would you like to share with all our listeners? Because just imagine you're standing right now at Heldenplatz, and you have the opportunity to deliver a message to everyone there. What would you like to convey?
What is the main point I wish to make? Yes, the health of both women and men is truly important for all of us. This affects every single one of us. It would really help us make significant progress if we simply had a greater awareness of it, if we were to actively promote it more, and in terms of prevention, that this is simply one of the very first and most crucial steps that one can take in order to age healthily and well.
Because that is truly what all of us wish for, isn't it? And in this particular aspect, women are once again at a slight disadvantage. They do get older, but they age with a significantly greater burden of illness. This means that they live longer, but with a significantly higher number of limitations. And that is something we absolutely must prevent.
And men, they too should be able to grow older, to age in a healthy way. That's exactly what we're talking about altogether.
And women, after all, at least that's been my experience, tend to be more open, let's say, to preventative measures and also possess a higher health consciousness. So perhaps on the men's side, there's still a little bit of catching up to do in that regard. This truly affects all of us. Dear Andrea, thank you so much for joining us today, for enriching the Move Days with your valuable insights. And yes, I'm really happy here if you still make the most of this time to adopt and keep up your healthy routines. We are in the final stretch. It's not much longer until Easter. And yes, let's continue to move more together. Use it or lose it.
More together for you, your team, and a good cause. Join the Movivo Move Days, the ultimate health challenge during Lent, and win exclusive prizes. Collect points for 45 days in the Movivo app, together with your colleagues, or in your own personal way. Whether it's through your favorite sports, breathing exercises, giving up sugar, or ice bathing, every point counts. Are you ready?